Okay, today I'm here with my patient, a 34-year-old person who identifies as female, and the patient ID is 123, and we are here to go over her food diary and nutritional analysis, and she is concerned about getting cavities while having orthodontics. So first we'll go through your findings from your assessment. So I classified you as periodontal stage is healthy because you are doing a really good job of keeping your teeth clean and eating a well-balanced diet, getting your regular cleanings, and so your mouth is healthy. We did find a plaque index of 10%, which means that 10% of the teeth in your mouth have plaque on them, which is a low number, so that's good. The ideal number would be 0, but it is hard to achieve that, so you're doing a great job and keep doing what you're doing. Did classify you as a moderate risk for cavities because of wearing those orthodontic aligners. So that is that. And then for health conditions, we have ADHD. Is that correct? Okay. And then taking Adderall for medication. Okay. And we'll discuss a little bit more about how Adderall can affect the health of your mouth in a few minutes. But Adderall can cause dry mouth. So we'll talk more about that. And then dental history, what looks like orthodontics from about 2023 to current. And dental habits, eating approximately 3 meals a day, mostly whole foods with some snacking, and coffee once a day. Okay. And then brushing with an electric toothbrush twice daily, usually. And then flossing occasionally, and looks like Act mouthwash morning and night. Is that correct? Okay, awesome. I also wanted to mention the purpose of the dietary analysis is to identify areas where maybe you're eating more sugar than you might want to, and to focus on maybe increasing like whole foods and less sugar and carbohydrates. So we'll look at your food diary here. Were there any foods that were surprising to you that had sugar in them? Just highlighted the sugar exposures.
Yeah, the spring roll.
The spring roll, yeah, that's kind of surprising that has sugar in it. But overall, looks like you're eating a well-balanced diet, and don't really think there is really much to change except for maybe eating a little bit more. Maybe just like on the days when it gets really busy. I know it's hard, but yeah. But overall, you're eating like enough calories. But dental hygiene school is hard, so gotta fuel up. So. Moving on, I will explain how cavities form. Are you familiar with that process? Not so much. Okay. Well, we all have bacteria in our mouth, and some of that bacteria causes cavities, some of it causes gum disease. So we can't remove that bacteria completely from our mouth, but we can reduce it by doing certain things like brushing twice a day, flossing after we eat, or at least once a day, going to our regular checkups and cleanings, and having professional fluoride treatments on our teeth, as well as having fluoride in our toothpaste and mouth rinses. And what fluoride does is it helps to remineralize our teeth, because when we expose our teeth to sugars and the bacteria in our mouth forms acid, that can cause our teeth to demineralize, so some of the nutrients in our teeth are taken out, and it leaves us more susceptible to cavities. So those are some ways to reduce our risk for cavities, as well as not eating too much sugar or too many carbohydrates. And if you do eat those things, it's important to just eat them around like meal times. Try to avoid eating them all throughout the day. Have you heard the expression "sip all day and get decay"?
No.
Okay. So what that means is the more often that we expose our mouth to sugars and carbohydrates, the more bacteria in our mouth can be created, and that bacteria eats the sugar, and then it produces acid onto our teeth, and that acid can cause our teeth to be weakened and for cavities to form.
Okay.
Yeah. Another way to reduce cavities is to drink water after a sip of coffee or a sip of soda.
Okay.
So yeah, it helps to neutralize the pH of our mouth. And so then I wanted to show you also the pillars of cavity formation. So acid, time, bacteria, and sugar. When all those things combine, it gives us makes us susceptible to cavities. So time is like the frequency that we consume those types of foods, and also how long it stays on our teeth. So it's important to brush and floss away the sugars off of our teeth. And then acid, same idea of we wanted to remove it so it doesn't sit on our teeth for too long and hurt our teeth. And sugar, those are kind of self-explanatory. And then the bacteria eats the sugar and produces the acid. And then, let's see. We talked about all of that. And we didn't have any, we did actually. There weren't any medical conditions to be concerned about, but the medication Adderall can cause dry mouth. And the reason that that's a concern is because we need saliva in our mouth to help wash away the bacteria and debris from our teeth. If we don't have enough saliva in our mouth, it creates a dry environment, and then the bacteria can grow faster, and it will keep our mouth at a low pH. And we don't want that, because that's when cavities are most able to form. So, if you have noticed any dry mouth at all, have you had any issues with that?
No.
Not so much? Okay. Well, if you do, just let your hygienist know, or your primary doctor, and he can help you find ways to combat that issue. Okay, and we talked about the plaque index, and did you have any questions so far?
No.
Okay. We talked about how much sugar. If you were to talk to a friend about what we discussed today, what is one thing you could say you learned?
Don't sip on my coffee all day.
Okay, that's good. Okay, and then for my documentation, I would document that I reviewed patient's food journal, evaluated sugar exposures, adequacy of nutrition, circled and showed the patient all those exposures, and discussed oral hygiene habits, dental history, social history, and everything that we discussed today.